I don't know. And then they were in a bunker. So it was like 4 seasons. And these people couldn't go out because the earth was still radiated.
Cool.
So then they started drilling into people's bones to pull their stem cells out.
How much do we need?
60 if you can get it, if not, at least 40.
Is it true if you put an air bubble in the bloodstream, it's going to kill you like on TV?
Sure.
Is that?
Yeah.
Go for it.
You good?
No.
Maybe 60.
You want to do 60 if you can?
Yeah,
Is
you
that
can.
it?
Yeah, if you're going to get your highest jump of platelets from taking more blood.
I can do that.
You don't want to look?
I can see.
Thank you, my friend. Alright. Oh, you just take that too? Cool. Hi! We're on a candid camera here. That was the aspirate for the PRP portion of the bone marrow aspirate procedure we're going to do today. And we're using the Arthrex Angel system to produce some highly concentrated platelet-rich plasma. Arthrex has gone to great lengths to determine what is the best proportion of cytokine to platelet concentration. That's why we're trying out their system today to make sure that it provides us and our patients the best outcomes. So that's what we're doing at this point. Now we're good.
And are we doing joint or tendon?
So today what we're going to do is we're going to acquire a bone marrow aspirate from a volunteer. The bone marrow aspirate will allow us to derive certain mesenchymal type stem cells, which we can apply in this case to the patient's knee joint. We oftentimes reference what's called the PSIS of the pelvis. It's the most superficial part of the pelvis, easy access point, and high harvest yield site for acquiring these potential bone marrow aspirate, which we can convert into a concentration of pluripotential cells for injection. Thanks.
So you're going to see in a second.
And then we'll do the A for the ACDA.
A for ACDA.
Now you can remove both of those filters from that white piece of paper and the jam shooting needle, but leave that plastic around the needle.
Okay. We just
Kind of pull up that little plastic there.
Pull straight like this. Okay. Thank you, my friend.
Perfect. Okay. So first thing we're going to do is take the first backlock syringe and we're going to suck up about half of that heparin.
And it's already, so I just kind of engage it. Is there anything as far as,
So do you want to use the ladders or do you not want to use the ladders?
you know, what's the value in them?
The ladders just help with hand fatigue, so you can use it, but some people consider it cumbersome if you're...
Yeah, I prefer not to
Okay.
engage them.
So let me see where you're at right now.
So,
Okay, you're perfect.
I'm okay, right.
So right now you're good. So yeah, suck up about half of that heparin.
okay. So that should be about 7 and a half.
About 5.
Okay, 5. Okay.
Yep. And then we're just going to run down like this and fully coat that whole syringe. Perfect. Now go ahead and attach that jam sheety needle, leaving that plastic coating on. We're going to rinse the needle now.
And just right in here?
Yep. So you kind of hold the needle up and then attach this, and you're just going to coat that outside, then you're going to pour all that heparin back into the cup.
Is that a door?
So, do you like this, inject and then suck back?
You can just inject it and then you can pour it into the cup.
Okay, I see what you're saying.
You'll see, but hold it up so it kind of coats that outside. Yeah,
Like this?
exactly.
And then pour
And you
that
can
back.
keep going for a
Okay.
while till it pretty much coats the whole needle. See, it's really is. That just
Gotcha.
helps with the clotting.
Okay.
And then you can pour all that and push the rest through back into that cup. You might have, there you go. All right.
Perfect, okay.
Okay. And then you're going to take that same syringe and you're going to suck up about 4 cc's of that heparin.
Okay, 4 cc's of heparin.
Perfect.
Okay.
And then put a little bit more back into the cup because we're going to need to rinse the other filter with that. So, perfect. And then you're going to grab one of your filters, unscrew the red cap,
Okay.
and you're going to push that heparin through the filter to coat the filter, and you're going to leave that in there. So once you push it through, you can kind of shake the filter a little bit. Perfect. So you can kind of turn it upside down, and then you can just leave that in there.
Disengage the syringe,
Yeah, you can. All right.
like so.
Perfect.
Same thing.
Yep. So other syringe though this time.
Okay.
We're going to coat that other one. Let's make sure. Okay, right now it's on the step. So if you want to turn it back
It
to
is
the
on the step?
right. Yep.
Oh, that's the step right there?
Yep. So
Gotcha, so that's not engaged, correct?
right, but see how there's that little hole right down at the bottom?
Mm-hmm.
You can push the plunger forward and then turn to the right, and that'll get to the side where you don't have the steps getting in your way. Some people love the steps, other people just don't want to have
Yeah,
anything to do with them.
The other system that I've used with the central side, I prefer not to have those steps. They have
Yeah. So we're going to rinse the same thing, pull the plunger all the way back to coat the hole.
Okay.
Like
Okay,
that.
I'm sorry.
Yep. Perfect. And then we're going to attach the other filter and do the same thing. Undo the red top, squirt that in there, and actually transfer you. Okay.
Okay.
Perfect.
Back
Now
in.
the last thing you're going to do is, yep, you can put that back
All right,
in. And then that ACDA cup, we're going to put 6 cc's into each of those syringes, and we're going to leave that in there for the
Right.
draw. So, quite a few steps in the beginning, but it's fine.
You want to do this one? About 6 cc's.
With the ACDA, it doesn't have to be exact. It's a very weak anticoagulant, just binding calcium. So.
Okay.
And all these precursor steps are done by a MD or a PA?
This is all MD or
All MD?
Yeah.
MD or PA.
Yeah, you can have a nurse do the rinse, but they'll be scrubbed in. But
Mhm.
everything else is done definitely.
Okay. Great.
Perfect.
Thank you.
So we'll just go ahead and do you have your mallet, or are you going to do it by
I'm
hand?
gonna do it by hand.
Okay. So we'll go ahead and go in by hand, and then just attach those syringes, fill them up, and then when you hand them off, we'll put on filter.
Okay, Stevie. A little nails like everybody wants to do. Okay, bud? Okay, I feel like I'm in.
You
Just
get
good.
to the bottom of that in?
You can, I guess, in certain spots. And then aspirate how much?
So fill it up as much as you can. Again, we need a minimum of 40. So if you can get 60, that's great.
Fill that one, buddy.
So you can see it says cycle 1. So all we do is do a new cycle. We'll say check your piece run, just so you know we add a new one. Put that on. So standard protocol. Nice and easy.
It's going to be
Hey, hold on, Steve. A lot of pain?
No.
Promise?
Yeah.
Yeah.
Should be. This one hopefully is the right one.
Yep.
I don't think so.
Turn. So turn it to yep.
Sorry, Steve. How you doing, bud?
Okay.
What does it feel like?
Weird sensation down your legs or your butt?
Just a deep sensation.
Like what, bud?
Well, there's definitely pressure, and then it's, in the beginning I felt it go down the leg, not like a nerve, but deeper.
Yeah.
And now it's more of, more pressure.
Okay.
So then passing that one off to me with the filter.
These nails up in your bone.
Perfect. And I'll take one of the filters as well.
Something
Yeah,
with that one.
Ah, there we go. Feel that.
It hurts when it comes down. You can feel something.
Uh-huh.
Negative pressure.
Oh,
Well, that's what's cool. But
Where do
it's
you
not
feel that,
sharp.
Stevie?
My butt. Okay.
Now we're into the phase. Now we've already acquired the bone marrow aspirate, and prior to that the PRP. PRP we obtained from the patient's peripheral blood from his vein, and in this case the patient allowed us to take bone marrow aspirate to obtain this mesenchymal stem cells that we're going to inject into his right knee joint. So right now you can see here there's two little glass windows labeled BMA with bone marrow aspirate, one's labeled PRP. The first one I'm going to take from is going to be from the bone marrow aspirate. Okay. Now from this, I'm going to plan on administering a little over 2 cc's into the right knee joint from the lateral portal site, directed at the compartment that has a peripheral mediastinal tear for this patient. Feel the pain there, obviously this is injecting in.
how you feeling, Steve?
That's a great time.
Now, I just want to actually,
It's
go
My
with
name
it.
is that precursor. Thank you, but
For 8. But
there you go. Perfect.
it'd be better if I don't. Probably, yeah.
Next, I'm going to go ahead and access PRP. Then to stimulate that same group of cells we just injected. Right into the medulla. So he had about a total of almost 6 cc's. All right, see if we can have it apply a little pressure there. Now, thank you. The remaining bone marrow aspirate, in a smaller quantity, will be focally administered.
Now it's about a 9.
To the area
It goes up
of the medium meniscus. In this case, I think it's okay to put these combined. It won't be too much to.
No, you can do, I mean, you
Well,
can
they
do
won't
lung, you
activate.
can do your lung.
So we're going to give another nearly 2 cc's directly into the area of the peripheral meniscus tear. I'm going to trephinate at the periphery of the meniscus for maximum effect. Good. And outside of a few grimaces, he tolerated the procedure very well.
It is.
Thanks.